Thank you, Premier. So the situation in Australia is that cases have risen above 400, more than 200 in New South Wales, now 121 in Victoria. It is important to recognise that the exponential increase we've seen in cases in Australia have really largely been driven by people who've travelled internationally. And so unlike the situation in northern Italy that took off, and some of the countries in Europe where there's been a really significant increase in cases, Australia's increase has not been driven by local transmission. It's been driven by returning travellers who've been identified and some of their close contacts who've developed illness. And so that is a different situation. And I do expect the numbers to change over the next couple of weeks. Clearly, with a level 4 travel advisory for all countries outside Australia, there'll be Australians wishing to come home in a hurry now. They've been encouraged to come home. And so some of those will have been exposed, they'll need to be in quarantine, and some of them will be identified as new cases over the next couple of weeks. But beyond that, I would expect to see greater control in the number of cases acquired internationally, and that might actually help with the increase that we've seen in cases overall. AHPPC, so all Chief Health Officers or equivalent, and Brendan Murphy met for 2 full days late into Monday and all of Tuesday to talk through all of these measures that have been announced today, but beyond that to a whole lot of issues around social distancing. So even though we've focused on outdoor gatherings and 500 people, and indoor gatherings and a 100-person limit, we're really trying to be explicit about the fact that social distancing thinking and shifting the narrative is for all settings of all sizes. We are trying to really embed the idea that we need to create a greater space between all individuals across the board in all settings, regardless of size. The 500 and 100 are very useful for ensuring that there's a legislative driver to make sure that risk doesn't occur for those sizes. But for all other meetings, it's really important to understand that there are things that you can do now and that you really must do now to protect yourself, and by virtue of that, protecting the most vulnerable around you. So it is important to wash your hands frequently. It will be absolutely important to exclude yourself if you're unwell. And this is applying to businesses, to organisations. For the safety of workers, for the safety of those that you serve, you will need to create greater spaces between you in offices. You will need to stay home if you're unwell. You'll need to make sure that you have alcoholic-based hand gel or soap and water available to everyone who needs it. These are really critical measures that are to be applied regardless of those 100 and 500 thresholds. In aged care, there was an absolute recognition that this is the most vulnerable population that really need extraordinary measures to be taken. And on the issue of extraordinary measures, because I have heard a lot of people calling for really very, very disruptive measures to be applied, but a lot of them are talking about it for 2 weeks or for 4 weeks. We were unanimous as AHPPC that the measures that we need to put in place need to be under consideration for 4 to 6 months, or if successful, 8, 9, 10 months. If we're flattening the curve to the extent that we want it to be, we need to understand that some of these measures will need to be in place in the long term. That if we are talking about it for 2 or 4 weeks and then lifting, we will only have deferred some transmission for a time and it'll all kick off again. So whenever we make a consideration about these really disruptive measures, we're understanding that they need to be in place for a protracted period of time. And so that is front and centre in our mind. We will have consideration of additional levels of control as required, and none of us are shy about the recommendation to do so as required. Thank you.
Just before we go to questions, I just got other things to do, so he'll...
Well, Dr. Sutton, this is, we're here and we're away from you at the moment. Is this the reality that everyone should be setting up essentially?
I think so. Spread your arms out, make sure that you're trying to be apart from other individuals to that extent. Whatever setting you're in, try and do that to the fullest extent possible. Clearly, if you're well, you're not so much of a risk. But we know that it can survive on some surfaces for a time. We know that we can carry it on our hands, and we know that some people will have very mild symptoms and may be out and about or may be at work, and they can transmit to others. So the measures that we all take will protect ourselves, but we shouldn't just think of ourselves. We should think about what it means if we become infected and that we're going to our elderly parents or elderly neighbours.
Dr. Sutton, just given a lot of some private schools are shutting down, talking about the need to keep schools open. Should those private schools be rethinking their decisions to close their doors?
I think schools are making operational decisions around how well they can manage with students withdrawing. So they need to make a call on the basis of those individual circumstances. I won't stand in their way if that's an operational reality for them. Clearly they have to deal with parental concerns, and as the Premier suggested, they are very reasonable concerns. People are worried about how severe this can be. We have emphasised that for children, especially very young children, the disease appears to be very mild in the great majority of cases. That should be of some reassurance. I think the other element to consider is that transmission levels in the community, with only 2 local transmission cases in Victoria, will be very low at the moment. But we're trying to embed these habits now so that when the risk increases, as it will, day by day over time, that we're doing the right thing when the risk is greater. There is no magic number that makes 100, the absolute consideration. As I've said, for gatherings of less than 100 people, they need to do all the right things in terms of social distancing as well. But when you bring in a threshold, you know that you won't get really significant gatherings of people indoors, and understanding that a lot of those settings, that'd be a bit of a crush. And so for some pubs and clubs and other settings like that, we know that if there's a limit of 100 or fewer, that we won't have really significant proximity of one person to another. But we will consider other thresholds, and we will consider other social distancing directives in order to manage that risk.
When was that brought out, those discussions? Was it brought up like discussions?
Yeah, it's been under consideration for a week with AHPPC. We have worked through some details. We've tried to review what other jurisdictions internationally have done, and people have picked different thresholds. But working through the details over the last 2 days has really embedded that as one of the principles that we think will be useful. No, I think we're trying to think of all of these things ahead of time. As I say, we're at a period in time where local transmission is likely to be very low. These are measures to put in place now to keep that level low. Yeah, I might let the Minister speak to the number of labs that have come on board, but testing capacity has definitely ramped up in recent days. We're catching up with the backlog, so for some people who've had to wait too long for their result, that'll be more timely. But I think it's really critical to have the testing capacity so that we can find all of the cases that might be out there, because isolation and quarantine is a key element of control. And to that extent, people who are unwell, whether or not you're being tested, isolating yourself at home until you're well is a really critical measure to take. So whether or not you're being tested, you can isolate now if you're unwell, and it may be coronavirus that you've got, but you'll not pass it on to others if you can isolate at home.
If you have coronavirus, is ibuprofen a little bit?
I've just heard of the Lancet report and WHO referencing it on ibuprofen. It's very early days in terms of that review. It seems to be a theoretical risk rather than one that's really been demonstrated. But I think we should talk about it in 10 minutes on AHPPC, and we'll try and make as timely advice on recommendations for Australians at the moment. What I would say is that if you're currently prescribed it, you need to talk to your prescriber. I wouldn't stop taking it now. We'll consider it. We'll provide advice as soon as we can.
Any update on the quarantine requirements? You were talking to us yesterday, the day before about you can still be at home in your garden, take the dog out. That's all.
It really is common sense. So think about how would you keep that distance from other people. So if you're walking the dog, if you're going to a park like this and you can stay away 1 to 2 metres from other people, then you should feel free to do so. But don't go into crowded areas. You shouldn't go to shopping centres. You shouldn't go to places where you know that you'll be in close proximity to others.
Have 100 people, say